Okay, so the trigger points occur, the main trigger point is just there, and then there's another one lower down. And the other set of trigger points are more medial, here and here. You can see they're all quite lateral. These are harder to find. These are much easier to find. The trigger points themselves, you feel pain, you usually feel pain deep in your back. People describe it as sharp and piercing. It's to the extent that it can take your breath away. People can feel like they're going to literally fall to the ground when these muscles are when the triggers are extremely active. Normally, when people have very active Quadratus Lumborum trigger points, they either getting up is unbelievably difficult. Once they're up, they're vertical like this, and they walk around like they're not going to move 5 degrees either way. They're just very stiff and very careful. They keep their backs quite vertical, and any bending forward, especially if you get to 15 degrees, bang, this awful pain comes on. Sometimes it's so severe that they will actually crawl on the ground because it's so painful. So this is when it's there, is such a terrible, powerful trigger muscle to have myofascial problems in. If you cough or sneeze, agony. So it's a fascinating, deep posture muscle. So now, what we look at is treatment of this muscle. And the treatment is quite difficult because the muscle is so deep. And you need to recognize that if somebody is like this, the muscle, the space available, if you've got someone with a long back, that's easy, but in someone with a short back or someone who's a bit plump, if they're in this position, it's very difficult to get into the quadratus. So what you need to do is lift, can I borrow this? Lift their arm up like that and stretch them out, which will give you access into the muscle edge. Then you're not going to be working from the back, but you're going to be working from the flank. So you feel the edge of the iliac crest, and then you're going to be coming round, and you can feel the edge of this big muscle mass. You're going to be coming right round from there in here, and then as you push down, you're feeling, remember most of the fibers are actually the vertical fibers, so you're going to be running across like this. You often can feel a tight band, and it's really rigid, and then when you hit the trigger, the person just about jumps off your bed. So you need to be careful. I use a thumb. I protect my thumb with either my other hand or my second thumb like that, but for showing you I can't do that. And you go down until you know it's obviously painful. Reduce the pressure. Now these you need to take your time. You focus, you breathe, you relax, and gradually you increase that pressure. It's going to take you usually 2 minutes of pressure working your way in, and then gradually feeling the trigger melt away. These are quite difficult, the medial ones, and you're working through a whole lot of overlying muscles. All you can do is you just find the point, you press in, slowly work away, and work your way down deeper and deeper. In my experience, the ridge, the edge triggers are much more common and much more significant. When the triggers are active, you feel the pain locally, but you also feel the pain referred to the top of the buttock. And a lot of people, this is the primary area that they feel their pain. Another group, this is the area that they feel their pain. Okay, so if you're going to now, so having worked on ischemic pressure, your next option is to use the cold pack, and the origin is the 12th rib, the insertion is the iliac crest, the pain zone is down into the buttock. So you start at the origin, you move slowly down like that, over into the pain zone, and then you put it on again, run down, slowly, over, and you do 2 or 3 runs of very cold. Now, to stretch out the muscle is quite difficult because it's deep and it sits almost at the central pivotal point of the spine, as I showed you. So usually the best way to stretch it is to bring the arm up above the head and bring that forward, bring this leg back like that. Sorry, can I get you rolling forward a little bit? That's it. Okay, so quite far forward there. This is back, and you can see the long fibers, how the long fibers stretch in this way. And again, you're going to tie this in with breathing. So you would breathe in. Can you breathe in? Hold your breath. Count 6. Run out of fingers. Breathe out. You carry on in your mind. 7, 8, 9, 10, 11. And this will just start to stretch and stretch and stretch. Then, thank you, you just bring back to relaxing, and then you apply the heat pack again over the area of the muscle into the pain zone, leaving it on for a good 5 to 10 minutes so that the whole area is nice and red, and then you do the stretch again. So arm above the head. Can I take your arm? Above your head like that. This leg comes back. Can you just stretch over? That's nice. And so you've got a torsion through the long axis. Leg back, arm over, going forward, and you're stretching the muscle like that.